Imagine a world where your glutes, the largest muscle group in your body, are practically asleep on the job. This is the unfortunate reality of dead butt syndrome, a condition becoming increasingly common, especially in our sedentary society. Also known as gluteal amnesia, this isn't a laughing matter. DBS occurs when your gluteal muscles, primarily the gluteus maximus medius and minimus, become weak and inactive. While the name might sound funny, the consequences are anything but. Weak glutes can lead to a cascade of problems affecting your posture, movement, and overall well-being. Picture your glutes as the foundation of your body's powerhouse. Just like a weak foundation can compromise a building, weak glutes can throw your body off balance, leading to pain and dysfunction. This condition is often silent in its early stages, lurking beneath the surface until it manifests as pain or discomfort. Don't let the silent nature of DBS fool you. Early recognition and intervention are key to preventing long-term consequences and reclaiming the power and functionality of your glutes. The rise of dead butt syndrome can be largely attributed to our modern lifestyles. Prolonged sitting, often dubbed the new smoking, is a major culprit. When you sit for extended periods, your hip flexors shorten and your glutes essentially forget how to activate properly. This sedentary behavior is often compounded by poor posture. Slouching or hunching over further inhibits glute activation and reinforces faulty movement patterns. It's like asking your glutes to work while wearing a straitjacket. They never get a chance to fire up effectively. Even if you're not glued to a desk all day, certain exercise habits can contribute to DBS. Overemphasizing quad-dominant exercises like squats without proper glute engagement can create muscle imbalances that further weaken the glutes. Several risk factors increase your susceptibility to DBS. These include leading a sedentary lifestyle, prolonged sitting, poor posture, muscle imbalances, and inadequate glute activation during exercise. Dead butt syndrome often starts subtly with whispers of discomfort rather than screams of pain. One of the earliest signs is a feeling of tightness or stiffness in your hips, particularly after sitting for long periods. You might notice that your glutes feel lazy or unresponsive during activities that require their power, like standing up from a chair or climbing stairs. As DBS progresses, you may experience localized pain in the lower back, hips, or buttocks. This pain can range from a dull ache to a sharp stabbing sensation. It's your body's way of signaling that something is amiss and needs attention. The consequences of DBS extend beyond localized discomfort. The weakness in your glutes can create a chain reaction, leading to referred pain in other areas such as your hamstrings, knees, or even your feet. This referred pain occurs because your body compensates for the lack of glute strength by overworking other muscles. Be attuned to these symptoms and don't dismiss them as mere stiffness or soreness. Early recognition is vital to prevent DBS from escalating into a more debilitating condition. Diagnosing dead butt syndrome involves a combination of physical assessment and understanding your symptoms. A healthcare professional, such as a physical therapist, will likely ask you about your lifestyle, activity levels, and any pain or discomfort you're experiencing. During the physical exam, they'll observe your posture, range of motion, and movement patterns. They'll assess your glute strength through specific tests, such as asking you to stand on one leg or perform a bridge exercise. Weakness or difficulty performing these movements can indicate gluteal amnesia. Your healthcare provider might also palpate or feel your gluteal muscles to check for tenderness, tightness, or muscle atrophy, which is the wasting or shrinking of muscle tissue. Section 5. Physiotherapy assessment, mapping out your glute revival. Physiotherapy plays a crucial role in diagnosing and treating dead butt syndrome. The assessment process typically involves two main components: subjective and objective evaluations. During the subjective evaluation, your physical therapist will actively listen as you describe your symptoms, medical history, and lifestyle habits. This conversation helps them understand your individual needs and tailor the treatment plan accordingly. The objective evaluation involves a hands-on assessment of your physical capabilities. Your therapist will observe your posture, range of motion, and movement patterns, paying close attention to how your glutes function during various movements. This comprehensive evaluation provides a roadmap for your glute revival journey, guiding your therapist in designing a personalized treatment plan to address your specific needs and goals. Section 6. Reawakening the powerhouse physiotherapy management of DBS. Physiotherapy management of dead butt syndrome aims to reawaken your dormant glutes and restore their strength, flexibility, and proper function. The treatment plan typically progresses through distinct phases, starting with activation exercises and gradually advancing to strengthening and functional movements. The initial phase focuses on reactivating your glutes and improving their mind-muscle connection. Your therapist will guide you through specific exercises designed to isolate and engage your gluteal muscles. These exercises might include glute bridges, hip thrusts, and clamshells. As your glutes awaken from their slumber, the focus shifts to strengthening exercises. These exercises challenge your glutes with increasing resistance using weights, resistance bands, or your own body weight. Squats, lunges, and step-ups are examples of strengthening exercises that target your glutes. The final phase integrates your revitalized glutes into functional movements that mimic everyday activities. This might involve exercises like deadlifts, kettlebell swings, and plyometric movements, which train your glutes to work in sync with other muscle groups. Section 7. Do's and Don'ts. Navigating life with DBS. Navigating life with dead butt syndrome requires a conscious effort to break free from habits that contribute to gluteal amnesia and embrace strategies that promote glute activation and strength. Do incorporate glute activation exercises into your daily routine. Simple exercises like glute bridges, hip thrusts, and clamshells can be done at home or even during breaks at work. Prioritize movement throughout your day. Set reminders to stand up, stretch, or walk around every 30 minutes to counteract the negative effects of prolonged sitting. Focus on proper posture. Maintaining good posture with your shoulders back and spine aligned encourages glute engagement and reduces strain on your lower back. Don't sit for extended periods without breaks. Prolonged sitting is a surefire way to lull your glutes back to sleep. Ignore pain or discomfort. Listen to your body's signals and seek professional guidance if you experience persistent pain or discomfort. Neglect glute-focused exercises. Make it a priority to include exercises that specifically target your glutes in your workout routine. Section 8. Cutting-edge approaches. Recent advances in DBS management. The field of physiotherapy is constantly evolving, and recent advances in treating dead butt syndrome offer promising new avenues for glute revival. One such advancement is the use of real-time ultrasound imaging, which allows therapists to visualize muscle activity during exercise and provide precise feedback on glute engagement. Another promising area is the integration of wearable technology, such as activity trackers and smartwatches, into DBS management. These devices can monitor your daily activity levels, provide reminders to move, and even track your progress during glute-focused exercises. Additionally, there's growing interest in the role of manual therapy techniques, such as soft tissue mobilization and joint manipulation, in addressing muscle imbalances and improving glute function. These advancements highlight the dynamic nature of physiotherapy and the ongoing quest to optimize treatment strategies for conditions like dead butt syndrome. Section 9. When to seek expert help recognizing red flags. While dead butt syndrome can often be managed effectively with conservative measures like physiotherapy, certain red flags warrant prompt medical attention. If you experience any of the following symptoms, it's essential to consult with a healthcare professional. Severe or worsening pain that interferes with your daily activities. Numbness or tingling in your buttocks, legs or feet. Loss of bowel or bladder control. Difficulty walking or maintaining balance. These symptoms could indicate a more serious underlying condition, such as a herniated disc, spinal stenosis, or nerve compression, which require prompt medical evaluation and treatment. Section 10. Embrace a glute-focused lifestyle. Key takeaways. Dead butt syndrome might sound like a laughing matter, but its consequences are far from humorous. The good news is that this condition is largely preventable and treatable with the right approach. By understanding the causes, recognizing the symptoms, and embracing a glute-focused lifestyle, you can reclaim the power and functionality of these essential muscles. Remember, your glutes are the foundation of your body's powerhouse, and their strength and well-being are integral to your overall health and mobility. Don't let your glutes fall victim to the perils of modern living. prioritize their health, and they'll reward you with strength, stability, and a newfound appreciation for the power of a well-functioning backside.